The goal of this brief slide deck is to provide some foundational knowledge, including some important definitions. This will help us to have a shared lexicon, so when you or I use a particular word or phrase, we'll have a shared understanding of what the speaker is intending for us to hear and to understand. Some of you might recognize some of these slides from your gender presentation during your orientation. So the story starts something like this. When we learn that someone is expecting a child or we learn that someone recently had a child, very often the first question that's asked is it a boy? Is it a girl? Do you know if it's going to be a boy or a girl? As though this is the only thing that's important, the thing that matters most. Generally, when we hear about sex and gender, most people often think that they're the same thing, that in fact they're synonyms, but they're not. Sex refers to the biological, physiological characteristics that define men and women, our external genitalia, our internal sex organs, our DNA. This is all biological when we talk about sex. On the other hand, gender refers to something that's socially constructed. It tells us how we're supposed to behave, what activities we engage in and what activities we avoid, how we deal with other people, how we deal with different emotions. Those are all socially constructed, and that refers to our gender, which is a lot of what we're going to be talking about during this course. Sex assignment takes place at birth, and generally, if there is a medical attendant in place, either a doctor or a nurse, they will do a cursory external inspection of the baby's genital area. And that person will then tell the parents of the new baby that they have a boy child or a girl child. So that in fact, your sex assignment was given to you by somebody else at the time that you're born. There are cases where it's difficult to tell, and there's something called confusing genitalia, but it is a very small percentage of cases, and in those cases, the doctor has a different conversation with the parents. Your gender identity is how you see yourself, what your innermost sense of what your gender is. And the only way to truly know what a person's gender identity is to actually take the time to ask them. And of course, if you do ask them, then it has to be done in a very sensitive and appropriate, careful way. Gender expression, on the other hand, is how we present ourselves to the world. So how do we carry ourselves? What are the clothes that we wear? How do we wear our hair? All the different things that go into how someone sees us externally is our gender expression. And that may or may not be consistent with our gender identity. It's how we choose for the world to see us. Sexual orientation, or as sometimes referred to, sexuality, is something very different. So that has to do with where do we get our emotional, romantic, sexual excitement? To whom are we attracted? And the truth is that this can be very fluid. It's not static. Most societies are, in fact, heteronormative, so we assume that people are heterosexual, even if that's not the case. Heterosexuals are attracted to people of the opposite sex. Bisexual people can be attracted to people of the same sex as well as people of the opposite sex. Lesbians are women who are attracted to other women. Gay men are attracted to other men. People who are mostly straight usually have sex with the people of the opposite sex, but sometimes with the same sex. Someone who's pansexual is attracted to all people. But what matters at the end of the day is that everyone can be themselves, without fear of judgment, without criminalization, and without violence. We make many false assumptions. The first is that gender is binary, that male and female, that there are only two. And in fact, when I went to school, that's what I was taught. And when I first started teaching, that's what I used to teach. But we now understand gender in a much broader way. So we understand gender along a continuum of which people find themselves at different points at different times in their lives. The boundaries between what we traditionally have known as male and female are not natural and clear cut. There are cases where people are born with a sex assignment, a gender identity, and a gender expression that are all aligned neatly, and those individuals are called cisgender. But that is not always the case. The important takeaway here is to understand that there are many times, many situations where, in fact, that is not. There are many different words that are used to describe different people. And over the course of this semester, we'll begin to understand what many of these terms refer to, what they mean. It's really important that we understand how we use language and the power of language. Some of these words can be very hurtful to people if they're said in a certain way, if sometimes if they're said at all. So we have to be very careful what language we use when we're talking to people and people. There are lots of stereotypes, and again, we will talk a lot about these throughout the course of this semester. But some of them include that men should be strong, they should be tough, they should have lots of girls, other men, sexual partners. They should be risk takers. They should always be self confident. They should be providers. They should be in control. They should be competitive. They should always be self reliant. And above all else, they should not be feminine. Same thing for women. There are stereotypes that women should be softer, they should be weaker, they should be submissive, deferential to particularly to men. They should be pretty and thin. They should be nurturing. They should be maternal. They should be emotional and sensitive. They should be sexually restrained, and but they should also always be social. And the issue about stereotypes is that there are some that are positive, but when taken to an extreme, they become a problem. And at the end of the day, you want to live your life so that you can do that in a way that makes sense to you, not by rules that are created by other people. So you can be a very strong woman. You could be a sensitive, emotional, nurturing man. Sometimes men don't have to be in control. Women can be in control. At the end of the day, we want to be able to live our most honest. Simply put, gender has impacted your options, choices, and opportunities, but it also has impacted the perceptions of how much one is valued in society. And it's critical that we understand the impact that that has had on our lives. One of the newer concepts that I think is critical is the issue of gender mainstreaming, and that's been embraced globally at this point by advocates for gender equality. And essentially, what that means is that purposefully, with intent, that you should consider the perspectives of both male and female people. You should understand that people who are identify and present as male or identify and present as female might have different views, and all of them should be taken into consideration when dealing with populations, when making decisions. And as is highlighted, all human beings are entitled to enjoy the basic human right of equality, of opportunity, unrestricted by prejudices associated with gender, sexual orientation, race, ability, age, religion, or health status. And I think it's critical to understand regardless of what kind of work we do, however we lead our lives, that it's important to think about both women and men. And too often, um, men, particularly white men, are in the position of making policies, making decisions, and they only think about it from their own perspective. And so we need to broaden the way about things. So at the end of the day, and this is the slide I will leave you with, the question is, how has gender impacted your life? Has it had an impact on the choices you've made, your successes, maybe things that you'd rather have a do-over for, the opportunities and experiences that you've had in your life here at Stony Brook, the major that you're pursuing, as well as your future plans or the ways that others treat you? These are the things we're going to be talking about in this course, particularly focusing on masculinities and the impact that they have. And I look forward to seeing you soon in the first class.